I want to, first of all, thank Dr. CJ for providing this platform. This is a masterclass kind of training. In 1 hour or less, will be done. It's something very beneficial if you're a healthcare practitioner already. So our topic today is selling your medical services, your consultation, whatever practice you are involved in, you are trying to market it. So what is sales? They say when you transfer value, when a doctor is sitting behind his own chair, I'm going to make it very, a lot of case study situation to explain to you. If you sit down to see a patient or a customer and you pass your consultation, your professional advice to that customer, to the patient, and then they pay a consultation fee to you, that is a sale. You have done a sale. All right? So it's the transfer of value from one person, a customer, a consumer, to a vendor, a service provider. In the case of healthcare, you are providing a healthcare services to your clients. I am trying to restrict this definition to the healthcare practice right now. At any point in time, you are offering any such services, you are conducting a sale. So then say, what is marketing? Marketing is a broader view of awareness creation. Like what the last doctor has said, she's creating awareness for her health, getting us interested. She mentioned in her conclusion and said, she said regular checkup. She said regular checkup. She advised us to go for regular checkup. So if you decide to obey that instruction and you go to a hospital, then the hospital will convert her advice to a sale. What she has done is marketing. She said, go for regular checkup. She did not tell you go to a hospital, do anything, but you decide to take the decision. Her awareness is taken as marketing. And then when the consultation happens, it's a sale. Just for you to know, I have been in the practice of sales for over 10 years. For over 10 years, I have been selling. And within this period, I hold an MBA from a Switzerland university. So I have been practicing and making discoveries around the healthcare space. I have many discoveries I've made. I have delivered many topics that are helpful to my present organization to make them remain distinguished, and unique in their approach to business. So that's why I'm having this chance with the AfriHealth to share with the doctors, the nurses, any healthcare professional here, what you could do to better your healthcare practice in terms of sales and marketing. Okay, so when you are interested in getting something or services from a hospital, you have become a lead. A lead is somebody who indicates interest to procure a service or access a service or subscribe to a service. He's interested in the clothing. He's interested in the supplement. There's a supplement I had yesterday. They gave me the flyer. I came back this morning and said, I'm going to come back to your booth. I need to know more. I have become a lead. Very soon, they're going to take my phone number, my email, my name. So I have become a lead. And then activities that are being done, like what Dr. CJ is doing for all the vendors in this place today, is called lead generation. The vendors, including my company this year that is there, anybody that goes there, if you make inquiries, this exhibition is for lead generation. It's helping people to get more leads or prospect for their business. Like I said, I'm going to be a bit fast. So then sometimes you hear about upselling or cross-selling, all right? So you will understand if somebody comes for consultation and is trying to do HIV testing and he has not done HB variant testing and it's a young person prospect for marriage, you will ask them, instead of just doing blood group APO, add HB variants so that the testing can be complete. Sometimes you say, instead of doing this, why not do this? From coming for complaint of knee joints, you are referring him or her to physiotherapy and then to exercise segment or gym that you already have in your facility. So you're trying to upsell your client or your customer. So some of these features can help. So some of us are consultants in gynecology, some consultants in radiology, consultants in physicians or family medicine, internal medicine, pharmacists, medical laboratory scientists. You have different roles. And you are going to define your market. You need to know who are the people who are supposed to be the ones subscribing to the kind of service you are providing. So you do not become jack of all trades. That's why you have gone to school, further education, to become a consultant or a specialist in a segment of the service. And you are going to look forward to those segments of the market so that you'll be able to provide them what they want. I have so many things to discuss with you, but there are so many topics. I want you to pay attention. The indirect sales. Indirect sales is what you do when you are not trying to sell anything to anybody, but you are providing value. What the doctor was doing today was provide value. She's sharing information, healthy living information, how to stay away from diabetes, how to stay away from stroke, how to stay away from high cholesterol. She was sharing value. She's not saying, come to my booth. She's not saying, buy my medicine. She's not saying, buy my supplement. She's providing value. Whenever you are providing value, without explicitly asking people to buy anything, you are providing, you are adopting a strategy of indirect sales. Pay attention to indirect sales. It is very important for healthcare practitioners. Then, of course, there are approaches to that: webinar, workshop, blogs, content development, and the rest of them. And then, of course, there is direct marketing. Direct marketing is a situation where somebody is making an offer. He said, buy this, buy that. This is the drug for headache. It's 10 naira, buy it. It's going to help you. So that opportunity you have